About a month ago, I was called upon to talk about stroke. Little did I know that a close family member of mine will suffer from stroke. My name is Dr. Ifedola Isibiri. I'm here to talk about stroke. A stroke is a bleeding or clotting event that interferes with blood flow to the brain. The World Health Organization has told us that stroke is the leading cause of morbidity and mortality worldwide, and it is likely to worsen in developing countries over the next 2 decades. There are 3 main types of stroke. 1. Transient ischemic attack. This is known as the warning or mini stroke. This is when anything temporarily blocks blood flow to the brain, causing a transient ischemic attack. Blood clots and the symptoms usually last for just a short period of time. 2. We have ischemic stroke. An ischemic stroke is when blood vessels to the brain become clogged. This leads to death of brain tissues. Ischemic stroke is subdivided into thrombotic stroke and embolic stroke. And lastly, we have hemorrhagic stroke. A hemorrhagic stroke is when there is a bleeding that interferes with the brain's ability to function. Bleeding can happen within the brain or between the area surrounding the brain and the skull. Hemorrhagic stroke is also subdivided into intracerebral hemorrhage and subarachnoid hemorrhage. Stroke is the second leading cause of death globally. It affects roughly 13.7 million people and kills around 5.5 million people annually. Approximately 87% of strokes are ischemic infarctions, and the prevalence has increased substantially between the years 1990 to 2016. The incidence of stroke has doubled in low and middle income countries over the years 1990 and 2016. Within the same period, high income countries have had a percentage of 42% decline of stroke incidents. This could be due to their robust medical system. The current prevalence of stroke in Nigeria is about 1.4% per 1,000, and mortality rate ranges between 21% to 45%. A 10-year review was carried out in University Teaching Hospital, Ibadan, Lagos University Teaching Hospital, and Ogun State University Teaching Hospital, and they accounted for medical deaths to stroke to be 5%, 8%, and 17% respectively. Epidemiological studies have identified risk factors for stroke. We have 1. Non-modifiable risk factors. These are risk factors that cannot be changed. 1. Older age, being a male gender, the black race, and of course, family history. The second risk factor is the modifiable or controllable risk factor. These are risk factors that can be adjusted with change in lifestyle modifications or use of medications. We have hypertension, diabetes mellitus, central obesity, high cholesterol level, and other cardiac disorders like atrial fibrillations. Drinking, heavy alcohol consumption, and cigarette smoking, or just smoking generally, are also risk factors which could be modified. Cessation of these social habits will also tend to prevent one from having stroke. And lastly, we have exercise. We cannot overemphasize the importance of having exercise. There are a lot of key events that happen that bring about stroke. For ischemic stroke, we have clots which obstruct blood flow to the brain. Once blood flow is obstructed in the brain, the brain begins to suffer from insufficient oxygen and glucose level. This brings about cellular homeostasis, which means the calcium ions and sodium ions begin to increase in the brain. With that happening, there begins to be a gradual progression of cell damage in the brain. And with cell damage, there's also increase of free radicals. With bringing about cerebral damage. For hemorrhagic stroke, bleeding which occurs due to a busted artery or vessel in the brain. With the bleeding occurring in the brain no longer functions properly. So the blood-brain barrier system in the brain becomes dysfunctional, which leads to increased intracranial pressure. With increased intracranial pressure, there's death, there's cell death, there's death of the cells in the brain, and eventual cerebral damage. What are the signs of symptoms of stroke? 1. Trouble speaking and understanding when others are talking. People who suffer from stroke begin to slur in their manner of talking. 2. They have paralysis and numbness on the face, the arms, and on the legs. Usually this affects just one side of the body. 3. They have headache. The patient might suffer from sudden headache, severe headache, which could be accompanied with vomiting, dizziness, and altered consciousness. And lastly, we have trouble walking. The patient may stumble, lose balance, or lose their coordination. When all these things happen, it's important to make a call and take the person straight to the hospital. There are various ways of diagnosing stroke. 1. Blood test. The healthcare provider will run blood test on the patient. 1. They will check for the blood clotting time. They will check for blood sugar levels and infections as well. 2. We have the angiogram. An angiogram is when a dye is placed in the blood and then an X-ray is taken on the head. This helps the healthcare provider find the blocked or hemorrhaged blood vessel. 2. Carotid ultrasound. This is using of sound waves to create images of the blood vessels in the neck. This test helps the healthcare provider determine if there's an abnormal blood flow towards the brain. 4. We have CT scan. CT scan is done immediately the patient is brought into the hospital. It helps the healthcare provider find the problem area and what has caused the patient to have a stroke. 5. We have MRI scan. MRI scan gives a more detailed picture of the brain when compared to a CT scan. 6. Echocardiogram. The echocardiogram is an imaging technique which uses sound waves to create a picture of the heart. This helps the healthcare provider find the source of blood clots. And lastly, we have the electrocardiogram. This is when electrical tracings of the heart is done, and this helps the healthcare provider determine if there's an abnormal heart rhythm which has led to stroke. Having a stroke has life-threatening consequences. The brain controls major functions of human life, so there are lots of complications that might come about with the patient having stroke. 1. We have behavioral changes. The patient might become more depressed or anxious. The patient might become more withdrawn or impulsive at social events or gatherings. 2. We have speech difficulties. The patient, because that part of the brain is usually affected when the patient has stroke, the patient might have difficulty in talking or swallowing. They may also have difficulty reading, writing, and understanding when other people are talking to them. 3. We have numbness or pain. Because of the stroke, the patient might have numbness or loss or decreased sensation on some parts of the body. And lastly, we have paralysis. If a stroke occurs on the right side of the brain, it affects movement on the left side. If the stroke occurs on the left side, it also affects movement on the right side. There are different ways to treat stroke, but treatment is based on the type of stroke. For ischemic stroke, an emergency intravenous drug is given to the patient within 4.5 hours the patient presents in the clinic. intravenous injection of combined tissue plasminogen activator, also known as alteplase, which is the gold standard of treatment in the management of ischemic stroke. For patients that have large clots, removing the clots with a stent retriever, that is, using a device attached to a catheter to directly remove the clot from the blood vessels in the brain. For hemorrhagic stroke, the most important thing is to control the blood and reduce pressure in the brain. Emergency measures such as 1. Transfusion of blood products to counteract the effects of blood thinners if the patient has been on blood thinners for a while. 2. We have drugs which will be given to the patient to reduce intracranial pressure, to lower the patient's blood pressure, to prevent spasms of the patient's blood vessels, and as well to prevent seizures. And in situations where the bleeding is uncontrollable, the surgery is done immediately. I have some exercises for you. Please go through and let me have your feedback through the preceptor. Thank you. How was it?